I'm Dr. Sulyman Scott, facial plastic surgeon at That Face in Chicago. Let's talk about a facelift. What is a facelift? A facelift is a surgical procedure that allows us to resuspend the face to a more youthful location. So with a facelift, what we're targeting is the nasolabial folds, the marionette lines, the jawlines, and the jawline. A facelift addresses the sagging and the downward forward motion of the face, which occurs as we age. Now, there are different terminologies to describe facelifts. One is based on the layer of the face that's being addressed or that carries most of the tension during the procedure. A skin-only facelift puts the tension on the skin, which is the least ideal of the types of facelift. This is because too much tension is placed on the skin, which results in poor scarring and also gives the appearance of the wind-blown look that is not aesthetically pleasing. Now there's the SMAS facelift, which addresses the fibrous layer deeper to the skin. The tension is placed in this layer, which gives a nice lift, but it's not as long-lasting as a deep plane facelift, which goes underneath the SMAS layer and allows us to resuspend the muscles and the fat pads of the face. This technique is the best of the ones that I discussed, as it takes tension off the skin. It appears more natural. There's little pull laterally that appears weird. Now, another way to describe facelifts is based on the level of the face that the facelift is actually addressing. A full facelift addresses the mid-face, the lower face, and sometimes the submandibular and submental part of the neck. The incision for a full facelift starts at about the temples and goes around the ears and goes back behind the ear into the hairline. Now there's the lower facelift, which has a shorter incision that starts at about this part of the ear, and that addresses just the lower part of the face, meaning the jaws and the jawline. Doesn't do much for the nasolabial folds. There's the ponytail facelift that allows us to lift the mid portion of the face. Now, depending on who your surgeon is, there's also the mini facelift that does some variations of the different layers or levels that I discussed. Now, what a facelift doesn't do is that it doesn't add volume back to the face. So it allows us to resuspend the volume that you already have. But if you've lost significant amount of volume in fat or muscle or just skeletal structure, then a facelift doesn't fix that. So to address those issues with a facelift, we would do a fat transfer, which allows us to take fat from a different part of your body and inject it into the face to put back volume where you might have lost volume. A facelift also does not address the quality of the skin. So with skin quality issues, there's a loss in collagen, elastin, there's increased laxity in the skin. This is addressed with skin rejuvenative treatment. So we either would do a CO2 laser treatment or a chemical peel to address the quality of the skin. Yes, a facelift allows us to remove the excess skin, but it doesn't fix the quality of the skin. So overall, a facelift is a great procedure and actually the best one to rejuvenate an aging face and to clean up the jaw lines, reduce the appearance of the nasolabial folds, the marionette lines, and jawline. So if you're interested in learning more, give us a call.